When we skip ACEs screenings, what do we miss? ACEs, or adverse childhood experiences, can result in toxic stress and are associated with 9 of the 10 leading causes of death in America. When you screen for ACEs, you have all the information. You're able to diagnose patients more effectively and maximize patient treatments and outcomes. 2 out of 3 Californians have experienced ACEs. And often, the Californians who are most likely to experience them have the most limited access to care. Medical inequality is bad for the overall health of San Mateo County's population, costs our state money, and hurts patients. Everyone deserves the best care possible. Screening for ACEs is a simple way to understand patients' experiences to assess the root cause of patients' health concerns.
I think it is so important for us to administer ACEs screening in primary care because I think it's really a starting point for conversations that are important and also difficult to have. It helps us kind of get a better clue of what's going on in their lives, which is important for treatment and just for healing and having therapeutic relationships. So overall, I think that it's really beneficial. Even if scores are all 0, it gets families and kids thinking a little bit more about trauma in a different way and in ways that can be helpful and healing.
ACEs screenings help us build a stronger, healthier community. And yet San Mateo County has one of the lowest rates of ACEs screenings in the state.
And think about trauma as kind of being more important to mental health or emotional health, but we don't think about how it kind of spreads into physical well-being or overall well-being. And so in order to provide holistic care, I think that addressing ACEs or at least starting to talk about them in that context can be really helpful.
The first day when we started doing the ACEs screening here at my clinic, so it's interesting, it's the first day. So I had a 9-year-old patient, first time seeing me, absolutely new patient, and she checked 9 boxes. I double checked with her that, did you understand these questions? And she actually started crying, and so did her 9-year-old child. And they said, yes, we have gone through this, and you're the first person who has ever asked us. That had I not had those questions, I wouldn't know and wouldn't be provided correct resources.
The training is easy, and the time spent with patients could save them and their providers from spending much more time on their treatments in the future.
I think that having that screening scanned into the chart actually serves to be very beneficial as we move forward. If kids then present, 6 months from now with another issue, it's something that we can kind of draw on and can kind of help inform our plans of care.
If you do have eClinicalWorks or an EMR, it's so easy to have it integrated into your systems. It might be harder if you're on paper, but still, it's another questionnaire, just like any other.
I'm glad we're doing it. I'm glad we're trying to find the source of the trouble, the source of their kind of mental illness or where all this is coming from. So I think I'm very glad that we're doing it.
Plus, Medi-Cal reimburses providers for using the established Pearl framework to screen for ACEs. Your time is covered and your patient's is too.
And I know I, for one, was very concerned about time. And I was also very concerned about bringing up and unearthing past traumas and then not having a toolbox of how to help families once we kind of reopen wounds or things like that. So some things that I found is that the screening doesn't add on that much time.
We send every patient who has a well visit an email reminding them that they have an appointment coming up. And before the appointment, they could potentially answer their questionnaires ahead of time, and they can take it in Spanish or in English.
I was concerned about how they would impact clinic flow and timing and everything like that. But I was happy to see that if anything, I think that they do save time in the long run by allowing us to kind of open up these boxes that need to be opened earlier and more efficiently and in a way that's kind and mindful.
I wish we knew about it much earlier, and I wish we had started it much earlier.
I feel very privileged that I could see families be empowered themselves and have such wonderful strengths And I think that the ACEs screening is a way that us as providers can kind of highlight that as well.
If they can start doing it, please do it. It's worth the time and the call.
Screening for ACEs helps you take better care of your patients. Be a part of creating a healthier San Mateo County. Be ACEs aware and start screening today.